The purpose of this presentation is to explore the many benefits of yoga. I have been practicing yoga for 2 years. Having such a positive experience, I wanted to learn more about yoga and share that knowledge with my fellow nurses. Yoga offers many clinically proven benefits. It can decrease anxiety, which is especially helpful during painful procedures, decrease skeletal muscle pain by relaxing and gently stretching muscles, provide more energy, partially because a yoga session rests the body as much as a nap. Yoga reduces the time it takes to fall asleep and improves the quality of sleep. Yoga has a synergistic effect with pain medications, allowing clients to experience pain relief with less medication. Over time, with consistent practice, yoga has been shown to alter brain structure in the insular cortex where pain is processed to increase pain tolerance to a level twice that of a non-yoga practitioner. Yoga benefits your whole self, not just your body. By decreasing anxiety, improved mental function is experienced in all areas of life. Immune system response is improved, helping to prevent illness. Yoga increases blood flow, improving perfusion of tissues. Overall, yoga practitioners experience an improved sense of well-being, insight, and creativity is enhanced, and flexibility is improved. Yoga is a mind-body practice incorporating postures, awareness, and control of breath and meditation or relaxation. Yoga is a process that deliberately controls the body by holding certain poses and gently stretching, while focusing on breathing, often with low lights or eyes closed, to promote awareness of self while deliberately relaxing. All these steps combined lead to physiologic changes in the body. The physiologic changes that occur in the body as a result of yoga are increased blood flow, electrical resistance of skin, production of slow alpha waves, activity of natural killer cells. Yoga decreases oxygen consumption, eliminates carbon dioxide, lowers blood lactate levels, lowers respiratory rate, lowers heart rate, lessens muscle tension, lowers epinephrine level, decreases gastric acid levels and gastric motility, lowering sweat gland activity, and lowers blood pressure. All these physiologic changes enhance wellness. Yoga originated in India from the ancient Indian philosophy. Yoga is a Sanskrit word that means to unite. Hatha yoga is most commonly practiced in the United States and Europe, emphasizing postures, breathing, and relaxation. Virtually anyone can do yoga, adults and children alike. Yoga is the 6th most common complementary health practice used by over 16 million adults and 1.5 million children. Yoga is beneficial for anyone who wants to maintain health, improve well-being, be more physically fit, relieve stress, and enhance the quality of their life. As well as maintaining and enhancing well-being in healthy individuals, research shows yoga can be used to target specific conditions, such as back and neck pain, to increase pain tolerance, important during painful procedures such as skin grafts, during cancer treatments, for burn and wound care. It's beneficial for arthritis, anxiety, cancer treatment supplement, behavioral health. For example, yoga was successfully an inpatient mental health facility to improve behavior in mentally ill teens. The stress of pregnancy was also studied and found to be lessened by yoga. African American teens also saw yoga as beneficial practice to help them with the added stress of being a pregnant teenager. Yoga developed over several thousand years, having its origins in Indian philosophy. Several schools of yoga have evolved from these origins. Different forms of yoga have developed, incorporating various postures known as asanas, controlled diaphragmatic controlled breathing techniques, as well as the various meditation and relaxation styles. Hatha yoga is the main form of yoga practiced in the U.S., and it has several subclasses to accommodate different needs. Yoga continues to develop and change as modifications of poses are used to meet the unique needs of different clients. To meet individual needs, yoga dosage is personalized by your instructor. If you practice without an instructor, yoga teachers recommend listening to your body and honoring what your body needs at that time. Yoga should not be painful. Yoga research studies have provided some guidance as to dose for various conditions in classes, but allowed for unlimited use at home based on how you feel. The doses ranged from widely from as little as 40 minutes a week in class with home sessions as desired to over 8 hours a week in class. Dose is really personal and is best to start out slow and build from there as tolerance increases. Contraindications for yoga are few. It is safe for healthy people. However, people who have high blood pressure or are pregnant should change positions slowly and avoid certain poses, as well as hot yoga called Bikram. Additionally, pregnant women should avoid laying on their right side or lying flat on their back, as both of these positions are not good for circulation to the fetus or to mom's brain. Glaucoma patients should avoid added eye pressure by keeping their head elevated, and those with sciatica should avoid poses that cause additional pain or numbness in the legs or feet. Research shows very few side effects. It is possible to have certain types of stroke or pain from nerve damage, but again, this is extremely rare. Research-based signs and symptoms of overdose include certain types of stroke, increased pain, eye pain or vision changes with glaucoma patients, worsening pain in the extremities for those with sciatica, dizziness, usually from orthostatic hypotension, can be avoided by changing positions slowly and becoming overheated. Again, this is troublesome primarily for those with hypertension or while pregnant. Teach your clients to take it slowly if they are new to yoga. Teach slow diaphragmatic breathing exercises, counting slowly while teaching how to inhale slowly, hold the breath, and then slowly blow the breath from pursed lips. Counting helps with learning the rhythm and remembering how to breathe. Teach gentle stretching. This can be done lying down even. Teach clients that pain should not be felt, and if they do, to stop. Meditation can be facilitated by speaking quietly, describing a peaceful setting, something like a beach with waves, by lowering the lights, repeating a simple chant or sound over and over, or by the addition of soothing music. Written instructions should be provided for home use. After your client has attempted yoga, evaluate how things went. How did they feel during and after? If improvements were found as would be expected for most people, that's great. Praise, reinforce previous teachings, and adding poses are all appropriate. If, however, the person had a negative experience, find and assess the issue and modify yoga as needed. Positions can be simplified. Only breathing or only meditation could be used. A smaller range of motion could be attempted as well. Current research shows yoga as a valid complementary treatment for many conditions, including back and neck pain, increasing pain tolerance, arthritis, anxiety, cancer, behavioral health, and pregnancy. Other studies showed promise with smoking cessation, as well as weight loss. Yoga has developed over thousands of years from ancient Indian philosophy. Yoga incorporates poses, breathing, and meditation, and offers physical, psychological, and spiritual benefits. Research has proven yoga has the potential to decrease pain, anxiety, tension, the amount of pain medication needed, while offering improvements in pain tolerance, range of motion, vital signs, circulation, all with minimal or no side effects. With the exceptions of pregnancy, glaucoma, hypertension, and sciatica, requiring caution and modified poses, yoga can be safely practiced by adults and children alike. Yoga research studies substantiate the multiple benefits physically, psychologically, and spiritually. Because poses and breathing can be modified, yoga is beneficial for virtually everyone. Therefore, yoga would be highly recommended to incorporate in your personal and professional life.